During the COVID-19 pandemic, the use of telehealth services exploded. People were stuck at home, but of course they still had to deal with medical issues and they got sick. And in response, Medicare expanded its coverage of things like doctor's appointments over the internet.
Telehealth's one of the bright spots that came out of the whole pandemic mess. It revolutionized things for us, especially in our rural areas here.
But that coverage expires at the end of this year. And if Congress doesn't act, it could be a major setback in treating sick people remotely. That's today's story of the day.
Support for Story of the Day comes from Claxton Hepburn Medical Center, dedicated to providing patient care and regional services to the people of St. Lawrence County. ClaxtonHepburn.org.
Hey, I'm David Sommerstein. It's Thursday, December 12th. First up, the Tug Hill Plateau and eastern Lake Ontario are getting hit hard by another lake effect storm today and tonight. The band of snow has drifted across St. Lawrence and Franklin counties all the way to the Vermont border. Jefferson and Lewis counties have both issued no unnecessary travel advisories for all vehicles. The Thousand Islands Bridge to Canada is off limits to trucks, buses, and other high-profile vehicles due to high winds. According to WWNY-TV, a state trooper was injured in a snow-related crash that temporarily closed Interstate 81 near the Arsenal Street exit in Watertown. The National Weather Service says places in the heaviest lake effect areas could see 2 feet of snow by the time the lake effect warning expires tomorrow morning at 7 o'clock. So on December 31st, a temporary provision in Medicare that pays for telehealth appointments will expire, unless Congress does something. If it doesn't, that would be especially devastating for rural healthcare providers and Medicare patients here in the North Country. Amy Feiereisel reports.
Historically, for many North Country residents, healthcare has been hard to access. Fewer doctors, long drives to hospitals. But there's been a big change since COVID in 2020.
Telehealth's one of the bright spots that came out of the whole pandemic mess.
That's Ray Babowitz from the Community Health Center of the North Country. It operates 4 health centers in St. Lawrence and Franklin counties.
It revolutionized things for us, especially in our rural areas here, like in the North Country.
Babowitz says virtual appointments get around challenges like long drives, bad weather, or mobility issues.
You can still have, these telehealth visits and keep on schedule with what your physician wants without having to take the risk of leaving your house if it's not necessary.
And there's a reason the health centers were able to start using telehealth. During the coronavirus pandemic, the federal government declared a public health emergency. That made it easier for patients, specifically Medicare patients, to receive care virtually because of how telehealth visits were reimbursed.
Right now, a Medicare patient can sit in their home and they can receive care via telehealth from any of their Medicare billing providers.
Marie Monjon is Vice President of Policy for the Community Health Center Association of New York State. She says the issue is that the telehealth reimbursement wasn't set in stone. After the COVID-19 public health emergency officially ended last year, Congress passed an extension. But it expires in just a few weeks. Monjon says if Congress doesn't take action,
health centers, community health centers specifically, will no longer be able to provide medical telehealth care to their Medicare patients.
Ray Babowitz says that would have real impacts on North Country seniors. He says telehealth visits work really well for routine checkups on chronic issues like diabetes or high blood pressure.
We've had great success with it across all our disciplines. We've seen a great drop in our no-show rates, for example, once people have the telehealth option.
Get rid of that option, and he says,
we will go back to people missing their appointments for unnecessary reasons. Worst case scenario, they end up at an emergency department, which is what we're trying to prevent to begin with.
Marie Monjon says if reimbursements for medical telehealth appointments are not extended, things will essentially revert back to 2019 policy. Now, how likely that is unclear. Monjon works in advocacy and says New York's congressional representatives are supportive of extending telehealth flexibility, and this seems to be a place of bipartisan overlap. Republican Congresswoman Elise Stefanik is supportive. Democratic Senator Chuck Schumer held a press conference about the issue last week in the Capital Region and warned that this so-called telehealth cliff could impact more than 200,000 upstate New York seniors.
It allows people who can't get to a hospital to get good health care. So it's convenient for them. You don't have to take off a day from work. You don't have to drive 50 miles, wait in the hospital.
But time is ticking. There are just days left before the extension expires. And the issue can't just be kicked down the road forever, says Ray Babowitz, if health centers are going to continue to offer telehealth.
Anything that's not permanent or long-term, it makes it harder for you to invest. Business is business, right? If you're going to invest millions of dollars in a service line, you need to know that it's not going to be yanked out from underneath you.
Currently, there are two pieces of legislation on the federal level that, if passed, would make telehealth reimbursement permanent. They're called the Connect for Health Act and the Modernization for Telehealth Act. But first up is that December 31st deadline for Medicare recipients. Amy Feiereisel, North Country Public Radio.
Bonus story today in honor of all you on the Tug Hill and Watertown areas struggling with that heavy snow. I hope you're safe. At some point, it will end. And that makes for great winter sports. After the post-Thanksgiving storm, I went with a friend to check out Rainbow Falls and Inman Gulf on snowshoes. And here's that story. It's Saturday, midday in the Tug Hill State Forest. And I'm with my friend. I'm on snowshoes. And I'm with my friend,
Hugo
Adaman from
Potsdam, New York.
And describe the scene for us, Hugo.
It's a veritable winter wonderland. Snow 3 or 4 feet deep. All the trees are snow cone covered. It's rather beautiful.
There is really tons of snow. We're breaking trail here. Huge evergreens here right on the edge of Inman Gulf, which is like a minor Grand Canyon here in the North Country. So we're going to tramp along it here and see what we find. We are right on the edge of the Gulf. Like if we took 3 steps to my left, we'd be falling down a really steep ravine. But you look across, you can see the shale rock in many, many layers on the other side. Listen to this. We just found little mini falls of water just coming out of the side of the Gulf, because we just walked over that area, right? And it wasn't a creek or anything. Just coming right out of the side of the Gulf. The snow is so light and fluffy, and even though we're breaking trail here, it's just pretty springy and bouncy. We're still at the side of the gorge. Now we can see the river. I'm not sure what river it is actually down there, but Hugo, what do you see straight ahead?
Appears to be Rainbow Falls through the crotch in the tree, coming down right next to the sheer shale cliff.
It's gorgeous. It's like a little, bridal veil of falls, a couple hundred feet.
I would say it looks like that. It's still 500 feet from us.
Yeah.
Across the gorge.
Yeah, we're looking across the gorge to Rainbow Falls. Very, very beautiful. Just evergreens with big clumps of snow on them, framing the falls. Yeah, and there's a sign there that says we're at the Rainbow Falls Lookout, I guess. Very nice. It's a lot of talk about the Adirondacks, but, the Tug Hill Plateau delivering here with a beautiful wilderness falls.
Winter perfect day. And early in the season, we have a lot to look forward to.
In the Tug Hill State Forest, I'm David Sommerstein.
I'm Hugo Adaman.
For North Country Public Radio. It's me back in Story of the Day land. The body of water in the Gulf, I looked it up, is Sandy Creek. We have more news all the time at ncpr.org. Again, careful driving tonight. No unnecessary travel in Lewis and Jefferson counties. Music today by Mark Corey of Watertown and Caretaker of Canton. I'm David Summerstein, North Country Public Radio.